So I was involved in a shooting where my partner was murdered, and it was very hard, obviously. I ended up shooting the person who killed him, but that was a lot of trauma to go through at 25 years old and not knowing how to go about navigating that, and not trusting the systems that were in place for counseling. And it took a good friend of mine to finally say, hey, you should really go talk to somebody. And I found somebody that I did trust. And I saw that person for the better part of 2 years until I was realized, okay, I'm ready to get back in and do the job again. And I felt like I had the coping skills necessary. So I'm the biggest proponent of getting the help that you need, because it was excellent for me to have. And I think that that's what we need as leaders, who are able to say, it's okay to get help. The idea of, hey, rub some dirt on it and get over it, those days are over. I mean, and so certainly from a first responder perspective, more first responders die from suicide than any other cause of death. That's a problem. And the only way that's going to get better is through early intervention, counseling, and normalization of what that counseling looks like. And so the earlier we start with our kids, where they recognize that that's normal, when they have issues as adults, it's going to be second nature. It's like putting on seatbelts now. When I first started driving, seatbelts were brand new, and it took a lot for people to start putting them on. Now you don't see anybody get in a car without putting their seatbelt on. It's just become very natural. That's my expectation with mental health, that we need to treat it as natural. This is something that all of us are going to maybe need at some point. There are things that occur, crises that occur around us that we have no control over. And as they stack up, you might realize you might need help. Sometimes that's one incident. Sometimes it's a compounding of incidents before you recognize you need help. So I do agree that early access to mental health is critical. And when there's something that's identified that somebody is struggling with, the sooner we get them help, the better off they're going to be long term.